What comes to mind when you hear about a large amount of deaths? Heart disease, cancer, gun violence? Those would probably be at the top of the list. But I wonder how many people would be surprised at the rate of overdose deaths due to prescription pain medication. In the year 2011, 16,971 people died of prescription pain medication overdoses. And this is a very personal and passionate topic for me. My goal is to inform my audience of the reasons for the opioid epidemic and the solutions to pull us out of this epidemic. There has been an astronomical rise in the deaths due to prescription pain medication overdoses. Prescription pain medication has been prescribed for a multitude of reasons and has become very prevalent in our society. We will look at the causes of why people get addicted, the reason for the rise in the epidemic, and the solutions that are proven to work. Many people don't understand what causes an addict to behave and act the way that they do. People think of addicts as homeless, unkept, felons, thieves, dirty. Addiction is a disease. In 1956, the American Medical Association classified alcoholism as a disease, and in 1987, addiction followed. It does not discriminate. It can affect any social class, economic class. It is hereditary, and if it is not passed down through the genes of your family, it can be a sudden change in the brain chemistry. From personal experience, without pain medication, after the body has ingested it over a substantial amount of time, the body becomes physically dependent. And with the lack of the pain medication entering the system, the body goes through a withdrawal effect that can be related to the flu times 10. This is the main reason why it is so hard for people to stop taking the pain medication, thus leading to the addiction. Since we reviewed what causes the addiction, we can talk about the reason for the epidemic. And in recent years, prescription pain medication, which is not readily available, has to be prescribed by a doctor. There was a study by Lisham Ashrafian that stated that 78% of pain medication is prescribed by a doctor. Only 48% actually comes from a drug dealer. So our doctors were prescribing the medication without knowing what an epidemic it was going to cause. Physicians prescribe pain medication for many reasons. Mainly acute pain caused by surgeries, and chronic pain, which comes from cancer, injury, or illness. And since we know what the reason is for the rise in the epidemic, we can look at the solutions. There are a few solutions to decrease the amount of overdose rates, hopefully decreasing the epidemic. There is treatment. 30-day treatment, long-term treatment. These treatments or rehabs teach abstinence-based living, where you do not ingest any type of mind or mood-altering substances. After treatment, most individuals will enter into Alcoholics Anonymous or Narcotics Anonymous. In recent years, a very popular choice in treatment has been medically assisted treatment. And this is where Suboxone or methadone or Vivitrol is given, and it stops the withdrawal effect, allows for the patient to not be high, and allows for the patient to continue living, but allow them to taper from this medication, allowing them to slowly come off of the pain medication, allowing the body to get used to no longer having it, thus not causing a withdrawal, making it easier to come off of the pain medication. With this info, we can begin to see the bigger picture when speaking of opioid addiction. An individual does not just wake up one day and want to become an addict. I didn't want to become an addict. We looked at the reasons why pain medication is so prevalent. We looked at the cause of the epidemic and the solutions to end the epidemic. There is substantial information for the audience to gain a better understanding of the epidemic and what possible solutions there are. The more people that are informed of the causes and the solutions, they can be more aware of what is being done to stop the epidemic. And with the knowledge that you have been presented with today, what will you do to aid in the fight against this deadly epidemic that is causing more deaths than automobile accidents?